Exatamente, então, a nutrologia feminina. Como a gente pode encarar? A nutrologia feminina é uma das poucas chances que nós temos. O estradiol também vai ter influência sobre o sistema nervoso central. Ele vai estimular o sistema nervoso central e, através da resposta do sistema nervoso central simpática, vai estimular
Good evening, ladies and gentlemen. It's an honor. Today we are live from Rio de Janeiro, Brasil. E eu falei em inglês para vocês porque hoje tem muito para falar em inglês, porque a gente está recebendo convidados super especiais. Então a gente está ao vivo do segundo dia da semana de aquecimento da formação em Nutrologia Feminina. E vocês vão ver que eu estou aqui hoje porque a nossa coordenadora, ela teve uma emergência, mas emergência não faz ela parar. Então, antes de falar sobre o nosso convidado especial da noite, eu já queria colocar no ar, direto do centro cirúrgico, Dra Alessandra Bedin. Alessandra, boa noite, obrigado por estar aqui com a gente.
Boa noite, good evening, people. We are here. Tá bom, melhor falar em português. Gente, obrigada. Desculpem a aparência aqui, estou aqui no centro cirúrgico mesmo. Mas como tudo na vida é questão de equilíbrio, né? A gente vai ver isso na aula agora. Faz parte também trabalhar, sair correndo, né? A gente tem que dar um jeito em tudo. Mas estamos felizes, isso que importa.
Então, gente, hoje a gente vai falar sobre Lifestyle Medicine. A gente está recebendo o professor Edward Phillips, direto de Harvard. Então, a gente está ao vivo do Rio de Janeiro, São Paulo, Belo Horizonte e de Boston também. Mas para isso, a gente quer construir junto com vocês, a gente quer que vocês participem. E o objetivo aqui é saber se vocês querem participar com a gente ou não. Então, primeiro, vamos nos apresentar, tá? Então, para quem não sabe, eu sou Guilherme Giorelli, eu sou médico nutrólogo, sou médico do esporte, sou coordenador da Nutrology Academy e da pós-graduação de nutrologia do Hospital Israelita Albert Einstein. O próximo slide que o pessoal deixou preparado pode passar o próximo, por favor, é da doutora Alessandra Bedin, então, que além de médica nutróloga, é médica ginecologista e está ao vivo aí do centro cirúrgico para mostrar para a gente a vida como ela é. Nosso terceiro convidado de hoje, então, pode passar o próximo slide, por favor, é a doutora Juliana Machado, que está ao vivo lá de Belo Horizonte. Doutora Juliana Machado é médica nutróloga, Se vocês já estão vendo o Instagram dela, vocês vão ver que ela foi correr em Boston na semana passada e tem muito disso para vocês entenderem. A Juliana Machado, então, é nutróloga, é a coordenadora da MTM do Hospital Governador Israel Pinheiro em São Paulo, é também professora da pós-graduação de Nutrologia do Hospital Israelita Albert Einstein. E o nosso grande convidado da noite é o professor Edward Phillips, que ele é professor da Universidade de Harvard, ele é fundador e coordenador do Institute of Lifestyle Medicine. Para que a gente está aqui hoje, então? A gente está para todo mundo junto debater e transformar dúvidas em conhecimento. E para isso, para saber se vocês querem entender mais sobre mudança de estilo de vida, assunto que a gente vai abordar muito no curso da Alessandra também, a gente queria mostrar antes algumas pessoas que estavam há um tempo atrás em dúvida e que já passaram por essa fase, já estudaram, já participaram do curso da doutora Alessandra. Então, vamos olhar primeiro os módulos do curso, para que vocês consigam ver.
Já foi pedido.
Olha só, o curso da doutora Alessandra, então, é um curso que vai falar sobre nutrologia feminina e vai falar sobre... vai falar bastante sobre mudança do estilo de vida, vai falar um pouco sobre como a gente faz para praticar no dia a dia a nutrologia em diversos cenários. E dessa forma, ajustando e individualizando para o dia a dia que a gente vai fazer e transformar as dúvidas em conhecimento prático. Então, se você quer receber o resumo da live de hoje, se você quer receber as aulas de ontem, o pessoal vai colocar agora o QR Code para você entrar no nosso grupo do WhatsApp. E no nosso grupo do WhatsApp você vai poder fazer parte e das oportunidades que a gente vai oferecer para você dar o próximo passo dentro aqui da Nutrology Academy. Então, dito isso, vendo qual é o módulo que você pode entrar dentro do grupo e ver como funciona o curso de Nutrologia Feminina, vamos começar a palestra de hoje. E falar sobre a palestra de hoje, eu preciso convidar, então, primeiro a doutora Juliana Machado. Juliana, boa noite, seja muito bem-vinda.
Boa noite, Guilherme, boa noite, Alessandra, good night, Ed. Eu vou, assim, é uma honra estar aqui para falar de estilo de vida, que é uma coisa que eu acredito, e com o fundador, né, do Lifestyle Medicine, né? Assim, é uma grande honra eu ter o prazer de conhecer o professor Edward lá em Boston semana passada. A gente conversou muito sobre o movimento, sobre o ensino da nutrologia e estilo de vida, né, lá em Boston. Pode ir, Guilherme, aí depois eu toco em inglês.
Então, Juliana, deixa eu só explicar para o pessoal, então, como é que a gente construiu essa live de hoje, porque é importante todo mundo saber que quando a gente sonha, a gente tem a capacidade de lutar para realizar, né? Então, há mais ou menos uns 2 anos atrás, a Juliana veio me falar do movimento apenas 2%, que ela já estava aplicando, e ela aplicou isso muito inspirada pelas aulas que ela viu do professor Edward Phillips. E com isso, a gente resolveu transformar isso no vídeo e o vídeo numa campanha. Então, primeiro eu queria chamar o professor Edward Phillips para estar aqui com a gente poder, então, mostrar um pouco do vídeo também. Então, Professor Edward Phillips, it's really a honor to have you here. We are talking... Oh! So everybody is seeing that he's already in our movement, apenas 2%, and with thinking about Brazil... Juliana went to see Dr. Philip, but didn't bring my hat and Alessandra. It's arriving, Juliana, our gift. So for everybody to know, Professor Edward, like 2 years ago, I was talking with Juliana, and she told me, Guilherme, you know I have a dream, and it's called Movimento apenas 2%, almost like only 2% movement. And the dream is not about myself. As you can see, Juliana is a big-time runner. How many marathons, Juliana?
10.
10 marathons already. And she is running all over the world. And she's telling me, oh, Guilherme, I'm so excited because I'm going to Boston and I'm going to run the marathon. And I don't know if everybody knows, but it's very difficult to run the Boston Marathon. Usually you have to have a pre-classification, and Juliana got this time to do this. It's a very important marathon in the world. So she told me, I'm going to do, and then the pandemic, COVID-19 started. And we were planning to go to be students in Professor Edward Phillips course, the lifestyle medicine that he started like in 2007, I think, but he will talk us more today. And then we didn't go to the course, and we didn't run the marathon. Juliana ran the marathon last week, but I didn't run the marathon. I still waiting for a next opportunity for myself. But then life happens, and today we are very proud to have Professor here and to talk about something that is bigger than us. When we have a patient at the other side of the table, we are used to, as a doctor, to say, "Oh, we have to do this and we have to do that." And a big image to start today is this one of Juliana with all of her medals. Because when we take care of ourselves, we can help others showing what we are doing. Showing has much more power than only talking about it. So with that introduction, I'd like to pass pass to Juliana, and Juliana will make the presentation together with Professor Edward, and at the end, me and Alessandra will come back to make some big questions. But Professor, we are very, very honored to have you here. We hope you'll come more times to Brazil, because we already have big gratitude for you. So Professor,
Thanks.
Good night. It's an honor to have you here.
Thank you.
Juliana, go ahead, please.
Okay. First, I want to say that I met Professor Edward Phillips while I was studying lifestyle medicine. I believe that behavioral change can impact in a better outcomes for our health, treating diseases, and prevent it. I've been planning to visit Boston in 2020, but pandemic came, and I was in the lifestyle course online in 2020, and last week it was I combined lifestyle medicine when I met Edward, and I ran the Boston Marathon. It's a great pleasure to have you with us. I'm so honored.
Thank you. So I wanted to express my gratitude. I've been down to Brazil twice, first in 2014 to give talks at Einstein Hospital, and then went back in 2017 at PUC University, sponsored by the folks at MedRio. So, and I'd love to get back down to Brazil. If you want to advance the slide.
Guilherme.
There we are. So that's me. You can keep going. I'll give you, and my email is there. I'd love to talk to you.
Esse é o e-mail do professor, né? Ele está falando que adoraria que todos mandassem e-mail para conversar. Fala um pouco, Juliana, então, sobre o currículo do professor.
Então, o professor Edward, ele é professor associado da Faculdade de Medicina Física e de Reabilitação de Harvard. Ele é fundador e diretor do Institute of Life Medicine, Spalding Rehabilitation Hospital, em Harvard, né? Ele é diretor médico de saúde integral do Hospital dos Veteranos, lá nos Estados Unidos, onde eu encontrei com ele. Ele é campeão nacional da educação em saúde integral para trainees, né? E lá o escritório dele é lá no Hospital de Veteranos.
And you can keep on going. Next.
Né?
There we are in Boston.
In Boston.
Before the marathon.
Yeah. And I was with the traditional jacket from Boston Marathon. Okay.
So the first off, in the world of lifestyle medicine, what we're trying to remedy is that we die too soon. And it's already been, you'll hear about physical inactivity, which is what we're trying to fight, obesity, poor diets, cigarette smoking, and excess alcohol. You can In Portuguese, it says.
Okay. Okay. Okay.
So up to 66% of deaths are due to these simple behaviors. So that's dying too soon. We're sicker than we need to be. Most of cardiovascular disease can be prevented. And this is 2020, a famous year now. This is a global issue. So 2/3 of all disease worldwide, not just Brazil, not just the US, is due to or simple behaviors that we know about. And next, in the US, we spend a great deal of money, $3.5 trillion, going up more, and the majority of it, 78% at least, is spent on taking care of chronic diseases, which are very closely related to the lifestyle behaviors. It's not exact, but very close. So I was on a panel writing in 2010 in JAMA, and we published a definition of lifestyle medicine as an evidence-based practice of assisting families and individuals to adopt and sustain improved health behaviors. And this was an initial chance to define lifestyle medicine. And the main thing is that it's evidence-based. So everything that you can talk to your patients about is things that we know make a difference. A few years later, there was new evidence to show that not only was lifestyle evidence-based and comprehensive, and again, you see nutrition, etc., but we now understood there was enough evidence that you could, of course, prevent diseases, but you could also treat and reverse them. So in Portuguese, so preventing and treating them is the main thing, because you can have a patient who has heart disease or diabetes, and with enough changes, they can reverse their disease. We don't talk about curing the disease, but reversing it. So you no longer maybe need to have your insulin or something for your diabetes. Next. This is from the American College of Lifestyle Medicine, and we'll talk about the 6 different areas of the sort of the pillars of lifestyle medicine. Sleep. I'd like to start with this one because it's so important. You can show it in Portuguese. Getting enough sleep, getting good quality sleep, having enough rest is vital to our health, our ability to forestall depression and dementia, and to staying healthy. So we need to invest in our sleep and avoid illness from not getting enough sleep. Next. Tobacco. This has been known for the longest time. And what's interesting about tobacco is that this is something in many parts of the world where the change has already happened. Next. So in the United States in particular, it used to be most of the adult men were smoking. This was 60 years ago, and that's changed very much. So now only maybe 18% of adults or less are smoking in the US. So this is a chance to understand that changes can happen on a large scale. Next. Stress management. Write to me if you're not under stress. Everyone has some level of stress from the world or from their jobs or from their health. Next. So we don't necessarily reduce our stress. If you have children, you're not going to reduce your stress. If you have a job, you're not going to necessarily reduce it, but you can learn to become more resilient. You can do things that will help to make you stronger, but also to manage your stress. Next. And then relationships. This has become increasingly understood as being as important an area as almost anything else, that the relationships that we have, even small relationships, even seeing each other's faces on the screen is better than not, but getting together in person is still the best. So relationships. And then the next one is nutrition. Sorry, we've got 2 more to go. You can go on. So we're talking about mostly plant-based, whole foods with good good fiber, good quality of foods, and of course not too much. So that's the North Star of our diets. And then the last one is Dr. Machado's favorite, and that's exercise. Regular, consistent physical activity. You can show in Portuguese, and it doesn't matter what you're doing. You can run a marathon or not, or you can do your exercises in the gym, or you can go for a walk, or you can go dancing. So whatever it is, however you want to do it, is up to you. And the most important thing is to ask yourself or ask your patient, what would you like in terms of doing physical activity or exercise? Next. So these are pictures of a plasticized body. The muscles came off of those bones there. And this is my reminder that we shouldn't just sit here and talk about exercise. So I'm going to invite my two colleagues and everyone on the call, even if you're watching the recording, I'm going to invite you to stand up for just a minute or two. And we're going to do a little bit of exercise. We're going to reach all the way up towards the sky. I've got my shirt on here, and I'm going to go up on my toes, if you like. I'm going to lean all the way to my left here. That's it. Just lean with me. Oh, you can go the other way. It doesn't really matter. Good. And all the way up. Breathe in and breathe out. And you can go all the way to the other side. Oh, it feels good, huh? And reach all the way up. And I'm going to now do a squat. I'm going to reach down all the way to the floor and pretend like there's a ball there and push it all the way up. And there's another ball that someone rolled underneath my legs. Oh, and Juliana just sent me another one. Dr. Giorelli just sent me another. Good. And we're going to just do one more. Good. And now pick your right knee all the way up in the air. Lunge forward. Lock your back hip in as though you're doing Warrior One. Ooh, all my yogi friends are coming up. Good. Arms are all the way up. You should feel a little stretch. If you feel pain, go back a little bit. And now let's pick up the other leg all the way up. Lunge forward. Arms up. Push forward and breathe. And I want you to be a good audience for us. So I'm going to invite you to sort of go in place. You can just pick up your heels or you can pick up your knees, and we're going to go, and you can count down in Portuguese. 5, 4, 3, 2, 1. Okay, big breath and all the way out. Good. I don't know about you, but I feel much better. So we'll go on. Yeah. And we'd love for you to put into the comments, if you like, how you feel after doing just a couple of minutes of exercise.
O professor está pedindo para o pessoal aí escrever, então, como vocês estão se sentindo aí depois de fazer esse exercício. Professor, before they answer, I will say, I think like 5 years ago, I went to a lecture, was in Paraguay, with Professor Annie Ferreira, that is actually the president of the Phillips, that Latin America enteral and parenteral nutrition, and they had something like that at the middle of the Congress. At first, I'll have to say, I thought, oh, here in Paraguay, they are so crazy. Why they are doing that? But your answer, your question at the end of the exercise, it's what makes really difference, because sometimes we have like anxiety, and we have such powerful medicine that is our body and our breathing. So it's really changeable. And so it's the first time that we do exercise together here with our audience. And everybody is sending WhatsApp messages saying that it was really different, because really make us to rethink the way we study and the way we teach. So it was very excellent experience. How about you, Juliana?
I feel great. I love exercise. My house, I have a academy, a gym here in my house. So I love it. And my patients in my ambulatory invite me to do exercise with them. So in my Instagram, I have some patients challenge me to do exercise.
So, Dr. Edward, we have some answers here. Dr. Sylvia is saying that she get happy, and Dr. Eliana Morinari said that now she's more relaxed, and Dr. Judith said that she really loved it.
So let's go on. We can always do more exercise later if there's.
Okay. Okay, you can go. Can change. The next slide.
So we'd like you to put in on the app or on WhatsApp or in here, what have you been doing to change your lifestyle or to promote change in your patients? We'll give you a minute to answer that. Sorry.
No, okay, you can. They can.
Não, vamos traduzir, Juliana. Então, o professor está pedindo para vocês escreverem aí nos comentários do YouTube o que vocês têm feito, então, para mudar o seu estilo de vida ou para estimular os pacientes a mudar o próprio estilo de vida. Então, Juliana, you can answer first. What have you been doing to change your patient's lifestyle?
And you can show it in Portuguese also.
Ok. Em português primeiro. O que eu falo para os meus pacientes é que eles têm que fazer, comer direito, fazer exercício físico, tanto resistido como aeróbico, exercitar a mente deles somente enquanto o coração bater, né? Tanto em casa como no hospital. Professor, I've said that I say to my patient that they must eat right, exercise themselves, exercise the mind, and as long as the heart beats.
Only that long.
Yeah. Even outpatients and inpatients. E UCI, in intensive care, patients has a enteral tube feeding, and I have a physiotherapist to do some exercise to mobilize them. So as long as heart beats.
Dr. Philip and Dr. Sylvia answered your question. She said that she listened to the patients, almost like a active learning, active hearing, right?
Mm-hmm. Excellent.
Eating and Dr. Healthy. Judith.
Yeah. Playing tennis, socializing. Very good.
Dr. Eliana said that she talks to them, start with smart goals, small goals that they can do it. Okay.
Juliana, do you want to talk about the next slides?
Okay. The next question, who do you feel, quem vocês acham que se beneficiam mais com a mudança do estilo de vida? As mulheres, os homens ou ambos? Quem que vocês acham aí que se beneficiaria mais em termos de ganhos com mudança do estilo de vida?
I don't know how to answer it evidence-based, but if I have to guess right now, I would say woman, because women always stick more to a healthy environment. Especially here in Brazil, men only come to consult when their wife bring that by the ear.
Okay.
Dr. Naira Grillo answered both.
Both. Bruna, also both. Judith
Coloca a resposta.
Yumer.
Dr. Judith answered.
Mulheres, Yuma.
Most of the people are answering both, Professor.
Excellent.
Ok.
Next.
Ok. Next. Ok.
Next question, Juliana?
Não, next, quem pode mudar? Pode mudar. Ok, pode mudar. Eu quero... I talk em português this article, this paper. Ok. Esse artigo foi publicado no BMJ em 2020. É um artigo de Dr. Ian Pin. O que ele mostrou? Né, que o estilo de vida saudável, né, pode deixar uma vida livre de câncer, doença cardiovascular e diabetes tipo 2. Né? Foi um estudo prospectivo, um coorte, pode passar, Guilherme. E o que eles colocavam como os fatores, né, os pilares, o que diminuía o risco? Né? Entram nos fatores que o Dr. Edward falou, do lifestyle, que é nunca fumar, ter um IMC adequado, entre 18,5 a 24,9, fazer uma atividade moderada a vigorosa, de 30 minutos por dia, e eu gostei dessa conta, porque quando eu multiplico 30 minutos vezes 7 dá 210, e 210 é o movimento apenas 2%, um consumo moderado de álcool e uma dieta de alta qualidade, que são os pilares do estilo de vida. Pode passar? E os dois, né, se beneficiaram. Se eu não fizesse nada, as mulheres, eu teria em 50 anos, 22 anos livres de doenças, como câncer, diabetes, doença cardiovascular. O homem também teria mais ou menos 22 anos. Se eu dos 5 eu fizesse 4, né, eu teria 35 anos livres. Quer dizer, eu ganharia 13 anos livre de doença, 13 anos em qualidade de vida, tanto para homens quanto para mulheres. Então, tanto os homens como as mulheres se beneficiam com a mudança do estilo de vida. Né? Pode ir, Guilherme. E aqui é só para... É uma brincadeira que eu faço, vocês sabem que eu gosto de fazer acróstico, né? E lá é a estrela da vida saudável, the Star of Lifestyle, onde cada letrinha tem um significado, né? Está latendo tu coração, smart serás. Tendrás que entrenar regularmente, experimentarás o descanso, equilíbrio, força e aeróbico treinarás, imitarás o tabaco e o álcool, a meditação é importante a ser, alimentação saudável doarás, né? Então, são os pilares do estilo de vida, lifestyle. Ok, professor, you can go.
So let me answer one of the questions from Sylvia about a patient that maybe had scored 0 out of 5 there. And the question is, where would you start in terms of helping their behavior? And the most important piece is to ask what matters most to the patient. What are their goals? So if I ask Juliana or I ask my patients and they want to take care of their grandchild, or they want to run a marathon, or they want to be able to walk to church, or to care for a newborn child or something, that we try to relate what they want to do to what, and then ask what's getting in the way. At that point, you know, what they want to change has to matter to them. So I've got patients that they could make changes in everything, but they want to get their knee feeling better so that they can take care of their new child. And in which case they're more willing to do exercise first. Other people, they have trouble walking and they want to be able to go with their family to church and they can't walk. And it turns out that if they stop smoking, that would be best. So the most important thing is to personalize the answer according to what the patient needs, and what they want to do. Do you want to translate, or you're...
O professor falou que uma coisa muito importante é a gente prestar atenção no que realmente importa para os pacientes. Então, não se trata de melhorar um exame laboratorial ou falar numa melhora de qualidade de vida que não é palpável para ele. Então, muitas vezes as pessoas falam que elas ficam... o que de fato é importante para elas é passear com um cachorro, é atravessar uma rua, até as brincadeiras que a gente faz no Instagram, às vezes o paciente ele quer ser mais curtido. Ou seja, ouvir a dor do paciente é o que ajuda a gente a convencer ele a dar o próximo passo, porque de fato são passos muito difíceis. Então, o resumo seria transformar a ciência e a medicina baseada em evidências em condutas práticas. Então, você vai se envolver com essa mudança dos 6 pilares do estilo de vida e, dessa forma, você vai atravessar a rua melhor, você vai conseguir passear mais com o seu cachorro, vai pegar seu neto no colo. Então, colocar de jeito bastante prático, né?
So, and then very quickly, Junie said maybe what's easier for them to change. Something that's small and can get them healthier will give people more confidence. So sometimes you start with something where they're closest to their goal.
E a pergunta da Júlia, então, sobre o que deveria ser como a melhor mudança, ele falou que a primeira mudança que o paciente deve dar, você deve propor ao paciente uma mudança que seja pequena o suficiente para ele perceber que ele consegue. Então, a conquista de um primeiro resultado, um primeiro passo positivo, é o que ajuda esse paciente a seguir numa jornada e, dessa forma, seguir em relação aos outros pilares, né? Então, não pensar em todos ao mesmo tempo na hora de definir condutas, um de cada vez, pequenas mudanças podem ter grandes transformações, né?
So I wanted to, along the way, welcome everyone to the world of lifestyle medicine as physicians and as other clinicians. There's a journal since 2007. Next. There's an encyclopedia that's come out since 1999. The 3rd edition is out, if you could advance, by Jim Rippey. That's available. Next. There's an American College of Lifestyle Medicine, which is growing very rapidly, and people from around the world can join that, as well as a local Brazilian Lifestyle Medicine Association. That's Dexter Sherney, the former president of the American College of Lifestyle Medicine. Next. There are multiple organizations in countries around the world, and there's a Brazilian Lifestyle Medicine Association. So this is going around the world. Next. There's an American Board of Lifestyle Medicine, and if you write to ablm.org, we'll also connect you to the International Board of Lifestyle Medicine. I was on the board. I just stepped down from that since getting it started in 2016. Next. And there are examinations all around the world. You want to point out Brazil?
O Colégio Brasileiro de Medicina do Estilo de Vida, né? CBMEV.
So Brazil is well represented in terms of people passing and this is now the International Board of Lifestyle Medicine. Next. What I'd like to do is a fun quiz for everyone. We'll start with, I'll invite everyone to put their hand up in the air, and you'll put your hand down when something comes along. So if you do not smoke, keep your hand up. Next. If you don't drink too much alcohol, no more than 1 drink per day, keep your hand up. Next. If you eat more than 5 servings of vegetables and fruits per day, keep your hand up. We're doing well so far here. Are you getting at least 150 minutes of the physical activity, cardiovascular physical activity per week? Keep your hand up. Are you getting enough sleep? At least 6 to 7 restful hours of sleep. Oh. Keep your hand up. Next. One more. And are you getting resistance training at least twice per week? Okay. If your hand is still up, if your arm is hurting, all of the above. Next. We'd like you to tell us who or what inspires you.
Então, a brincadeira que o professor fez foi pedir para todo mundo ficar com a mão levantada e abaixar-se se você não atingisse alguma das metas, né? Então, as metas eram, se você não fuma, continua com a mão levantada. Se você bebe menos de um drink por dia de bebida alcoólica, seria o segundo ponto. O terceiro seria mais do que 5 porções por dia de frutas ou vegetais. O quarto seria mais do que 150 minutos de exercício físico por semana. Se você dorme mais do que 6 a 7 horas por noite de sono. E se você faz exercício de musculação pelo menos 2 vezes por semana ou mais. Se você respondeu sim para esses 6 pontos, o professor gostaria que vocês escrevessem aí dentro nos comentários do YouTube o que te faz aderir a esse estilo de vida. Então, só se você respondeu às 5. E se você não respondeu às 5, também bota aí o número de respostas positivas que você fez, tá? Mas o que te motiva? O que faz você todos os dias não fumar, não beber, se esforçar em fazer exercício, em dormir bem? O que faz você ter esse estilo de vida saudável? Passar para você, Juliana. Quer falar como que você faz para esse estilo de vida saudável?
Bem, I need to improve my sleep. I need to... I don't smoke. I don't drink alcohol. I do exercise, cardiovascular and resistance, and I eat fruits and vegetables, more than 5 portions a day. I try to talk about my patients to change what is more easy for them to start. If exercise, it's easier, so I will start with exercise. To change diet habits, I go more slow, but some of them accept and change. When they do it, they change, they feel better, and they don't want to go back. It's a great feeling to change.
No, Dr. Edwards, Viviane is saying that she do all the 5 steps because she wanna get older with health. She doesn't want only to live longer, she wants to live with health.
Perfect.
Dr. Bruna is saying that she only met 4 of them. Dr. Maria do Rosário also 4. Dr. Ana Heloísa also 4. Dr. Isabella is saying that she takes all of them because makes her happy.
My mother, 3. My mother said she does 3.
So when we do this quiz, it is not to embarrass anyone. It's to remind us that almost all of us have something to work on. So when we talk to our patients, we should be a good model, but also they know that we're not perfect.
O professor falou que quando ele faz esse questionamento, não é para a gente se sentir diminuído, é para colocar a gente no local do paciente e entender que a gente também passa por dificuldades e que passar por essas dificuldades e melhorar elas é o que torna a gente melhor, né? Dr. Judith is saying that she's 75 years old and that keeps her very healthy and active. And Dr. Milena is saying that she wanna get older with health and very little comorbidities.
Excellent.
Dr. Luciana is saying that she do all the 5 steps because it gives her pleasure and conscious of self-love. She learned that with her parents since she was a little child.
Beautiful.
Professor, I'm going to answer that. I didn't do the 5 steps. I finished in 4. But something that I always think about is how I want to live with my grandchildren, because it's not about the heart beating. It's about how life it is, right? And so lifestyle, as you showed us, makes a lot of difference. And once we started, we are able to get better results, right?
There was a public health campaign that said, "Picture yourself dancing at your grandchild's wedding."
No, that's
And,
so
and
nice.
if you do the math, you'll realize that you're probably going to be old and you have to be in shape to dance. So, but I think it's even more important to enjoy today and not just 30 years from now.
Perfect.
Next.
Let me go back to the slides here.
So we'd like to invite all of you to join us virtually in just a couple of months. We'll be broadcasting from Boston and from people around the world we've started this conference. The first conference was in 2006. So this is, I think, number 26. So you're invited. And one of the most important changes this year is that the course is being translated simultaneously in both Portuguese and in Spanish.
Então, o professor está convidando todo mundo a participar do curso dele. Esse ano, a transmissão ao vivo vai ter tradução para português e espanhol. Então, dia 10 e 11 de junho, ao vivo, da Harvard Medical School.
Então, a tradução vai ser simultânea, em tempo real para o português. A tradução simultânea de áudio será fornecida em português para todas as palestras do curso do Lifestyle Medicine, to Promoting Health Change, nos dias 11 e 12 de junho. Basta se inscrever no curso e optar por vir em português no momento do curso. As traduções não serão gravadas, né? Todos os aspectos do curso serão exclusivamente em inglês. Isso inclui slides dos professores, né? Materiais de recursos, aplicativo do curso e site do curso, né? Então, o material do curso que a gente vai ter acesso, né? Vão ser os slides, os recursos, aplicativo do curso, as perguntas aos palestrantes devem ser escritas em inglês para que possam ser compreendidas e respondidas. Todos os formulários e comunicações da Harvard Medical School, incluindo a avaliação do curso e o certificado do curso, estarão em inglês. Tá? E tem algumas perguntas frequentes, né, que os alunos fazem. Como faço para ouvir o curso em português? É só se registrar como costume, né, escolher a tradução de áudio simultânea para português. Ao fazer o login no momento do curso, você poderá mudar para o inglês e espanhol, se quiser. Os pré-cursos, né, de entrevista motivacional, o chef coaching, também são traduzidos? Não, apenas o curso principal de 2 dias, né? O do Lifestyle Medicine. Vai ser no dia 11 e no dia 12 de junho. Poderei ouvir as gravações posteriormente do curso ao vivo com tradução em português? Não, né? As apresentações gravadas serão apenas disponibilizadas em inglês. Os vídeos em inglês permanecerão disponíveis por 90 dias. Então, depois que acabar o curso, eu tenho 90 dias após o término do curso. Qual é o custo de ouvir a palestra em português? É o mesmo do custo de inglês, né? Então, assim, você não paga mais pela tradução, né? Já está incluído na inscrição do curso.
So at the course, we talk about lifestyle medicine and the importance of it. Kim Williams is a cardiologist he will present on plant-based diets to prevent and reverse heart disease. We focus on clinician self-care, why it's so important, sort of like the poll we just did. We'll have an experience with meditation, mindfulness, and stress reduction. And then learn about coaching from Dr. Beth Frades, who's becoming the new president of the American College of Lifestyle Medicine.
Então,
o professor... Quer explicar, Júlia? Explica, por favor.
Pode falar. Então,
o professor estava explicando sobre o curso fala sobre sobre o porquê é importante e como você aplica a medicina do estilo de vida. Fala sobre as plant-based diets, né, as dietas plant-based e o impacto que isso tem nas doenças cardiovasculares. O autocuidado médico profissional, por que falar sobre isso e por que isso é importante. Fala sobre estresse, mindfulness e meditação e condutas do dia a dia. Então, o porquê, como, quando, como que a gente faz para aplicar isso na prática do dia a dia.
We also speak specifically about obesity and how to treat it. We already heard how important sleep is, and we will do this in the middle of the day and won't disturb your sleep. The time zones line up with Brazil very well. We want you to know how to make changes in your patients. That's a topic we're discussing here, even if just a few minutes with them. Dr. Stancic will speak about her personal journey with chronic disease, and Dr. Tracy Godet will present on whole health.
Quer falar, Juliana?
Então, vai ter uma parte sobre medicina da obesidade, né? Estratégias que a gente pode usar na prática clínica, falar sobre problemas com sono, as intervenções que a medicina do estilo de vida pode ajudar com o paciente, né? Como a gente pode fazer, né? Quanto tempo eu preciso para fazer com que um paciente, né, adote, né, seja encorajado para adotar estilo de vida, e assim, a gente não precisa, né, e pode fazer isso em até 5 minutos, né? Soluções, né, para otimizar o cuidado do paciente com doenças crônicas e, né, a saúde total, né, trazendo para a sua vida, na sua prática clínica.
Dr. William Miller and his partner, Dr. Rolnick, invented or characterized motivational interviewing. He's our special guest. We'll be talking about underserved populations. And then we finish with a big discussion about physical activity, but again, also about health equity. And I'll talk about exercise prescriptions, and we'll do more exercise.
Então,
Juliana.
vai ter entrevistas, vai ter algumas entrevistas motivacionais. Assim, no curso, a gente consegue ver algumas entrevistas, simulações, tá certo? A promoção de atividade física, né? E a prescrição de exercício físico, né, para os pacientes, né?
I invite you to stay in touch with me. I'll respond to your emails or join us on our Facebook, all the different ways. Next. Here's the way to sign up for the course. I had to convince my chair of the department to pay for the translation. And I said that I would have lots of friends from Brazil and Central America joining us. So I need to prove myself right and to pay for the translation. So I invite you to join us.
You have Professor, me, Juliana, will both attend online this year, and hopefully next year we can go physically to the event. And we'd like to say that it's a very, very honor for us to have you here and to hear you talk about such big things that usually we have some difficulty to translate it to real life improvements. And you put things so naturally. I'd like to start making a question. Usually here in Brazil, we are, especially here, I live in Rio de Janeiro. I don't know if you remember Rio, but we live in front of the beach. The beach is very close to
Beautiful.
Everything. The city is built around the beach. And once we talk about why do you want to adopt a healthy lifestyle, 11 out of 10 people say, oh, I want to look better. And usually what crosses the mind of every medical staff is, oh, you have to look more than this. You shouldn't look just to look better. And almost like looking better wasn't a nice thing to think or to look into, have. I wanted to question you, what do you think about? Should we stimulate this? Oh, there's no big deal in wanting to look better, or you have to look all the way more than that?
Oh, it's very difficult, especially as we age, to look as good as we used to. This becomes a frustration also around the world. Brazil, the US, and much of the world, we're carrying more weight than we expect or that we would like. And trying to get rid of the weight is is difficult and very frustrating. So if we're talking about how we look, and that means what do we weigh, I usually try to more talk to my patients about their function. Are they doing the things that they want to do? Are they participating in life as they wish, regardless of how they look?
I'll call back Dr. Alessandra. That is directly from Eisen Hospital, from the surgery area. And Dr. Alessandra, do you have any questions? I think you're muted. Okay.
Sorry. I have a question. What would you counsel your patients to start? If a patient doesn't have any pillar made, what would you say to him?
So I would ask, what sort of changes they're thinking about making, and it doesn't matter what I say. I can't make them do anything. So I ask them what they're thinking about changing. And as was discussed even in the chat, there are some of the participants saying maybe start with the simplest thing. So for instance, for some people, an extra glass of water, I finished mine, is already a start. And going to bed 10 minutes earlier may be a simple thing to start with, or walking an extra 500 steps. So I would start with small, simple things, but it has to be important to them, and it has to help them reach their goals. So back to the conversation about what is it you want to do, what's getting in your way, is changing the behavior going to get you where you want to be?
That's nice, thank you.
Juliana, quer fazer uma pergunta?
Yeah, someone from the audience asked about COVID lockdown and how about relationship in COVID lockdown. It was a problem of health when we have to get inside our houses.
In the United States, I know this best, they talk about an epidemic of loneliness. People are not seeing their neighbors, they're not seeing their relatives, they're not seeing their friends, and it has negative health consequences, and COVID made it worse. So it's definitely an issue, but the good news is that sometimes even a small I look you in your eyes, even for a moment walking down the street, even that's helpful. And we ask people to reach out and to be also creative in how they're using, let's say, even the time during a lockdown. I'm not good yet, but I learned how to cook during the lockdown because we spent a lot more time at home. My wife was busy because she is also a doctor, a psychiatrist, and takes care of patients. So someone had to do the cooking. So I learned more because of COVID. So we look for the silver lining, but we having the relationships and spending time with people is more important, or as important as ever.
Okay, thank you. I learned to play the piano in pandemic.
Dr. Edward, there's a question here from Dr. Bruna. She's asking if you could explain how does a consult of lifestyle medicine works? When it's time to ask for another specialist to do a consult on your patient? How far can you go in a consult?
So there are two very different ways of approaching lifestyle medicine. One of them is to ask for all of us to talk to our patients a little bit differently, to change the conversation and to focus on what matters most to them, and to talk about health behaviors and to help our patients change. I think we all have some piece of it. When I have a patient who's very excited or wants to make a bigger change, not the small changes, then that's the role for a lifestyle medicine specialist. And there are clinics, there are places where you could go and maybe live there for 2 weeks and change your diet, learn how to cook, start exercising, get on a better sleep schedule, write to your relatives that you haven't spoken to. You work on all of these things. So the American Board of Lifestyle Medicine, the International Board of Lifestyle Medicine, actually recognizes us as either lifestyle medicine physicians, that's all of us, or some of us can go another step higher and become like a specialist or an intensivist. At the VA where I am, the Veterans Administration Hospital, we want everyone to change their language and to promote health. And we do not have a specialist.
Perfect. Professor, another question here is from Dr. Pedro Luis. He's asking about metrics. So you told us you have to sleep more than 6 to 7 hours. You have to do 150 minutes. I'd like to add in this question, is this the main metrics? And what about body composition? Do you think it's a good metric to show the patient that he didn't need only to lose weight? I mean, he needs to look for body fat. He needs to look to body muscle mass. How do you integrate these things?
So the body composition would be an outcome, or as you said, a metric. Most of what we've spent this time talking about, and in lifestyle medicine, we more talk about the behaviors. So if everyone does the 210 minutes per week, we'll all be somewhat healthier. Some of us will have a better body composition than others, but someone who starts to do the 210 minutes is going to improve their body composition regardless. They're going to be in better shape. We could go down that path and measure how healthy someone is. How fast can you walk? How much weight can you lift? What's your body fat? It's easier, I think, to for the population and in our offices just to talk about behaviors, and knowing that the evidence is there that it will lead to improved function and improved health. We are at the VA, we're doing this. The VA is the Veterans Administration in the US. We're starting to see changes in the veterans, the patients who do the different behaviors, who actually engage in lifestyle medicine. It's much further to get to that point to actually show it. It's a much bigger study to show that. So we're still at the stage, I think, of just promoting healthier behaviors.
And another question is from Dr. Phillips. He's saying that based on your work, do you think that we could motivate people to eat healthy by teaching them how to enhance this taste experience? How to do it?
So I've become a big fan of cooking, and understand that just asking someone to eat something that's, quote, healthy and it doesn't taste good, they will not. Life is too short. And why would you want to eat something that doesn't taste good? As part of the course that we're doing in June, we have a whole day where we teach people to talk to their patients about cooking, and about cooking at home, and about making delicious food that it doesn't matter what's in it. You know, people will want to eat it, and it's only later that you say, oh, it had very little meat, or I took the meat out and I replaced it with other ingredients. So I think Felipe is absolutely right. It has to be delicious. That's the most important thing about eating. We have to enjoy it.
And Doctor, there's another question for Dr. Andrea Pereira. She's also a clinical nutrition specialist in São Paulo, and she went like 3 years ago to your course, and she's saying that last year at the Obesity Week, there was an article from the showing that a NIH study showing that only 40% of cancer patients were informed about changes in lifestyle. And why do you think that doctors are not talking about it?
We don't learn about lifestyle in medical school or in our residencies or in our fellowships. And in addition to running the CME programs for the past, maybe 15 years, I've been working to change that. I think that the more that doctors know, the more that we experience these changes ourselves, the more that we have stories of patients who have changed and improved their health and reverse their diabetes and extend their lives despite heart disease and cancer, the more we're going to be encouraged to talk to cancer patients about their diet. It's part of it is the doctors need to be healthier, and we need to know more. And the evidence is there. It just needs to be front of mind for us to recommend these things.
Professor Edward, we here in Brazil, we're still in medical school. We don't get a lot of hours of study, even about obesity. But when we have, lots of people always like to say that obesity is so simple. You should only eat less and move more. And if it's so simple, why is it still a pandemic after 4 years?
So obesity is a disease, and I think as I come to understand this, it's probably best to look at it more as the result of so many other things going on. In other words, all of the behaviors we talked about, not getting enough sleep, having too much stress, not getting enough exercise, eating not just too much food, but the wrong foods, and then adding in tobacco and alcohol, all of these things can contribute to someone gaining weight and basically having obesity. So I think we need to see this as a disease. We need to treat it as a disease. We also need to understand that once you gain weight, it's very challenging not to lose it, but to keep the weight off. It's not a matter of someone being weak or not having enough will if they gain weight. Otherwise, all of us, most of us, would be weak and have poor will. So we need to see it as a disease and treat it that way.
And respect as a disease, right? So everybody must be at the same page to understand it. Yes. Another phrase that we love to tell our colleagues here in Nutrology Academy is that the phrase "you are what you eat" is terribly wrong, because if everybody eats the same thing, we have such different results. Yeah. We have to be more than that. How do you think about that?
I agree that we need to go beyond you are what you eat. Back to obesity, it's not just what someone actually eats is only a small part of it. One of the things that I'm learning, actually, in writing a book about lifestyle for my patients, is that all of the behaviors together are more important, and that the eating is just one piece of it. For instance, if you're lonely and you're stressed, you eat the wrong foods. If you're tired, you'll reach for foods that have more fat and sugar. We talk about the process, more ultra processed foods. Just taking that out of your home is not enough. You need to address the causes and why you feel like you want to and need to eat poor quality foods.
Doctor, thank you very much. We are talking about such big pillars of medical school that we didn't realize it in medical school. The people that talk about that is the people that wants to stay studying, that have to study more. There's a big gap of knowledge. And for that, we thank you so much. Me, Juliana, and Dr. Alessandra, we are such big fans of you. And you have to know that our movement, only 2%, was really inspired with what you did like 20 years ago. And having you here using the shirt is almost like a dream come true. And we are very, very happy to have you here.
Thank you so much. We'll see you
so
soon.
Now, before we finish, we want to show our movie about our movement. We are ready to put it. Estamos perto? Então, vamos ao vídeo. Apenas 2%. Professor, thank you very much. We are very honored to have you here. I want to pass to Alessandra to her final words. Alessandra, thank you. Tem que só acho que tá travado aí.
Dr. Phillips, I'm so honored to have you teaching me all the things I admire on you. It's an honor for us to learn with you. Thank you. Guilherme, obrigada. Ju, obrigada também. I'm very, very happy to have you teaching us so many things.
Thank you for the opportunity.
Please. Okay. Dr. Philip, please go ahead.
Oh, I very much appreciate the opportunity. The only thing I would ask next time is to be able to come to Brazil directly to enjoy the wonderful people and the beautiful country. So in the future, we'll do that again.
We will make that happy. Queria muito agradecer a Alessandra por ter deixado a gente invadir aqui a semana de aquecimento da formação em Nutrologia Feminina. Dizer que muito do que tem lá dentro do curso a gente aprendeu com o professor Phillips e a gente tem grandes novidades para mostrar para vocês. Então, Alessandra, sei que você está corrido aí no centro cirúrgico, pode voltar que eu continuo tomando conta aqui do pessoal e a gente volta com a doutora Juliana e o Dr. Edward.
Obrigada, tchau, tchau, gente.
Obrigado.
Tchau.
So now the person who made this meeting possible. I usually I have to say that I thought that to have Professor Philip would be almost impossible, but for Juliana nothing is impossible. Juliana is unstoppable. So Juliana, thank you very much to be such a kind friend. To inspire all of us. Dr. Philip, you should see Dr. Juliana Instagram account. Every day she puts movimento apenas 2%. She's running, she's doing resistance exercise. She's studying, she's doing push-ups. And so, Juliana, very, very honored to have you here and to be one of our leaders. Thank you very much.
Thanks, Guilherme, and Professor. it was a great pleasure when you said yes to me to meet in Boston. And he told me that he would run Boston in 2020, but it was not possible because of the pandemic. It was a great honor to meet you and to have you with us this night. All my residents listen to us, and our students listen to us. Thank you very much. I loved it.
Obrigado. Thank you so much.
Thank you, professors. I wanted to have you here, and we were going to make that happen. You come to Brazil, and you will try Brazilian exercise like capoeira or Brazilian jiu-jitsu, and Brazilian food like tapioca. And I don't know if you haven't heard of queijo de Minas. It's like a Brazilian cheese, very excellent. Lots of good protein.
Excellent. Thank you.
Então, gente, um beijo. A gente vai se despedir aqui do professor, vai se despedir da Juliana também. Eu queria mostrar para vocês um pouquinho, então, a mais do curso, mostrar o QR Code para vocês participarem, pedir para o pessoal colocar o QR Code, então, do curso de formação em Nutrologia Feminina. O vídeo, se vocês quiserem receber o vídeo que a gente acabou de mostrar para vocês do movimento Apenas 2%, é só entrar no nosso WhatsApp ou entrar nesse grupo de WhatsApp, pedir diretamente para o administrador, se você não quiser receber vantagem. E o que a gente busca aqui na Nutrology Academy é o que a gente aprendeu com o professor. É inspirar através daquilo que a gente acredita, inspirar através daquilo que a gente faz no dia a dia. Então, ter o professor aqui, acho que é um grande marco dentro do ensino da Nutrology Academy. A gente tem uma grande honra de mostrar esse caminho e, mais do que isso, de criar essa comunidade onde a gente pode, junto, construir uma nutrologia mais forte. Nutrologia essa falando sobre alimentação, exercício, suplementação, unindo diferentes profissionais de saúde, unindo diferentes especialidades médicas em prol do nosso paciente. Então, se eu tivesse que ficar com uma informação hoje do que o professor falou, é felicidade. É felicidade que a gente percebe no dia a dia. E a gente é muito feliz de estar aqui com vocês. Então, eu queria passar, por favor. O pessoal tem o vídeo dos depoimentos aí para passar. Então, o vídeo das pessoas que já passaram pela Nutrology Academy no curso de formação em Nutrologia Feminina. Amanhã a Dra Alessandra volta aqui com mais prática, mais pergunta. Um beijo e até amanhã às 7 da noite.
É um curso bem didático, muito embasado em ciência. A forma da Alessandra fazer a aula eu acho ótima, bem didática. São aulas pequenas, aulas curtas, fáceis de assistir. Eu gostei bastante. Para mim está sendo muito enriquecedor. Os convidados que vêm, né, fazer a apresentação das aulas nesses cursos são sempre médicos que têm um conhecimento muito profundo, né? Muito acentuado.
Eu comando o ambulatório de climatério aqui na universidade. E assim, a maioria das coisas da aula de menopausa eu já tenho aplicado com os meninos já.
Conseguiu abrir minha cabeça para várias coisas, de ideias, de interesses mesmo. Até modificou, assim, de forma bem considerável a forma como eu vejo a paciente hoje, a forma de abordar, a forma de atender, porque a minha assistência de pré-natal modificou depois que eu fiz o curso.
A aula ao vivo ali, do formato que é muito produtivo, porque é muito específico na dúvida do dia a dia mesmo. A aplicabilidade clínica, que é o diferencial do Nutrology Academy.
O componente do curso em si sobre a saúde feminina foi muito legal, muito completo, assim, gostei bastante. Não só recomendaria, como recomendo, porque na verdade a gente tem um grupo, né, de colegas, né, de nutrologia. Eu sempre elogio, sempre coloco lá sobre os cursos.